She's better. Hello, Matt. Thank you so much for joining me today to have a little chat about the community close cycle. Really appreciate your time. And for anyone that's, listening in and watching, please can you share with us, first of all, like your role in EPUT in the NHS and with the acute mental health wards? What is your role? And tell us more about what you do, please.
Yeah, and hi Charlotte. Thanks for inviting me to this interview. So my name is Matthew Sisto, or Matt, and my role is Director of Patient Experience and Participation at EPUT. And I've been in this role since April 2021, so just over 4 years now. The teams that I oversee is the patient experience team, PALS and complaints, volunteers, chaplaincy and peer support, which is this growing initiative that started about 2 years ago now. And I think it's important to just say that my role is a strategic role and is all about working with services and the people and communities we serve to improve the experience of care for people in our services and their loved ones.
That's amazing. And we met, didn't we, back in 2023, the beginning of, because I joined the pilot for peer support. And that's how we first were introduced to each other. And even you and I were on the wards together initially, working with the service users, the patients, and in that role. So you are very hands-on, aren't you, as well as overseeing a lot of people, a lot of teams, and people within those teams. Um, So you've seen the work that myself and Amanda and our team are doing with the close cycle from its very infant stage. So it'd be really nice to hear, just personally, what do you feel about the Community Close Cycle initiative? And as if anyone doesn't know about the project, we're bringing in pre-loved donations of clothes from the public locally who are consciously giving to patients who don't have access to clean, usable clothes that fit them. And we see there's a need for it. But what do you personally feel about the idea of the community close cycle itself? I'd love to know that.
Yeah, so I do remember when this started. You're right, Charlie. You and I were working on the walls together side by side when we introduced the peer worker role, which was a wacky idea that people felt that it was wacky, but actually it was fundamental. And I think closed cycle is another example of something that is fantastic and innovative and meeting the basic needs of people that the NHS can't do. And what I mean by that is the NHS don't have the funds to provide people with new clothes when they come on the ward. That's not necessarily what they're there to do. They're there to treat and get people well. But it is such a basic need, and I think closed cycle bridges that gap. But it's really important that initiatives like closed cycle continue to help the National Health Service to meet that gap because it is so fundamental for people getting well.
Mm. Yeah, I agree with everything you said there. And it's what do you feel like in terms of impact that you've seen? I know you haven't been on the wards, but I've shared with you some stories. I don't know if you've seen or heard how it's making differences in people's lives for the people that are on the wards. Have you got anything you want to share about that impact?
Yeah, so I've got a personal story. When I was a peer worker in one of our wards, and it was a male adult working age acute ward, and there was a gentleman there who was really unwell, like psychotically unwell, and I felt really quite moved about the fact that he came into our services with not a stitch on his back,
Mm.
and we'll call him Paul. And I remember with Paul was that not only was he psychotically unwell, he also had a learning disability. And with those two things combined, he was continuously soiling himself, right? There's no
Yeah.
other way to put it. And Paul also had open wounds on his legs, so I felt really quite disturbed, if I'm honest, about
Yeah.
how this whole episode, it seemed so obvious, so easy, really, just to provide Paul some alternative clothes and to help. But the service and the staff in the wards, they felt almost helpless to be able to do that because they didn't have access to funds or to clothes or
Yeah.
all of the things that you need to meet that basic need. And so I did rush to Primark and I've got a few bits. But sadly, because of Paul's state of wellness, unfortunately, the cycle continued. I think something like closed cycle, had closed cycle been around, perhaps we could have better met the needs of Paul. We could have provided some alternative clothes. We
Mm.
could have helped, and that would have helped his own recovery in the service as well. Because when we're talking about open wounds and infection prevention, all of those things, they come into it. So this isn't
Mm.
just a nice to have for me, this is essential.
Yeah. And I think that that's a lovely story. Thank you. There's this the offering of something to them when they feel, I've noticed there's this common feeling of like li- giving up on life and that nobody cares.
Mm.
And so the act of giving something for free, something that they need and that they don't have to pay for, that they're quite shocked sometimes in that receiving, or someone loves me enough to give me this gift. It's a gift of love. It's a love language, isn't it? Get the gifts of
Mm.
giving. And I think that can give hope to somebody as well. And we see that story that you share a lot. It's happening on all wards across the board. So yeah, thank you for sharing that and noticing that there's a real need for it practically, physically, and in order to feel good about yourself, in order to start that recovery journey, I think something like clothes is just so, like you say, essential. Yeah.
Just to say that was 2 years ago, right? So we have been on a journey together with the
Yeah.
support of Community Closed Cycle. So those challenges, those cases are becoming fewer and further between because our
Mm.
peer workers, they know how to contact Community Closed Cycle and the
Yeah.
team. We now have repositories on the wards in the units that where people can access clothes that come in through the
Yeah.
community cycle. And just yesterday, I was at a team gathering for the peer workers, and they were talking about, oh, I'm going to do a closed cycle pop up on my ward, and I'm going to access this. And people aren't saying, oh God, there's a person that's come in, they don't have a stitch on their back, they're in anti-ligature clothing for too long. I mean, all of that affects someone's personal dignity and their own sense of self-worth. And I see closed
Mm.
cycles as a fundamental part in shifting the narrative, the position we are as an organisation with that. So
Mm.
2 years ago, Paul, not a stitch on his back, soiling his clothes, infection control issues, just not getting better. And now, fast forward, we have access to clothes on most of our services. The peer workers know who to talk to as and
Mm.
when, and we're not seeing the same issues. That wouldn't be possible without the community closed cycle.
Wow. That's amazing. And the peer workers are getting to do these pop-up shops whenever they feel it's necessary and the right time, which gives patients something to do and enjoy, especially those that love clothes and they can browse. And it's just a really fun, joyful mini event, I think. So that's really good to hear that the feedback has been well received across the board. And we've got really good connections now with the ward managers who can also email us and let us know if there's a crisis call outs where patients come in, they're admitted and they haven't got anything, um, they haven't got access to anything, and so they need something like ASAP. So we can respond to that as well and guide them to this storage of clothes. So yeah, it's really great to hear that, Matt. How do you see the project therefore developing? Obviously, we need continuous support from the public, and thank you to the public who are amazing and so willing and lovingly donating clothes that they don't want anymore. Some people even buy, packs of underwear. Underwear is quite tricky for us to obviously get donations are from because it needs to be clean, brand new. So thank you to everyone that's donated. But how do you see like this continuing and growing, evolving? What would you like to see happen to it? Have you got any ideas even? Because you're very an ideas man as well, I think.
Mm. Yeah, so my aspiration or hope for community closed cycle is that all of our services, all of the people that use our services who need the support from community closing cycle have access to it. Whether it's an inpatient service or a community service. And that's just EPUT. But actually, I think that any public sector organisation, any national health service could gain hugely, or their service users, the people in communities they serve could gain hugely from having access to community closed cycle because it helps those who are most disadvantaged to kind of
Mm,
overcome one
yeah.
of their challenges often and basic needs about access to fresh and clean clothes. And we're not just talking a jumper in winter, we're talking underwear, socks, some of those essential basics that people that aren't so disadvantaged take for granted, really. So my aspiration is that firstly, across EPUT, everyone who uses our service has access to community closed cycles if they need it. And beyond that, across Essex and across the East of England region, it would be fantastic to be able to support closed cycle to provide a service across a much broader footprint.
Amazing. And hold that vision. Thank you so much for your time. And is there anything else you want to add before we finish the chat?
Now, I do think it's important to touch on, so there is that meeting of basic needs, but I do think it's important to touch on that sense of hope,
Mm,
self-worth, and the aspect of community that brings in. So when I volunteered with you on the pop-up shop that we did in one of our units in Chelmsford, what I saw was an opportunity for people to get off of the wards,
yeah.
have a chat, experience that kind of normal life of going to the shop and talking to people in the shop and looking at items that you kind of reminisce over. Oh, I used to have a pair of jeans like that, or it's a break away from that
Yeah.
sometimes really difficult
Yeah.
environment of a ward. But in addition to that, I think what I like to see with all of these initiatives is us working together to challenge stigma. And that isn't just stigma of how people observe or believe people to be in a mental health unit. It's also the self-stigmatization that people feel about themselves being in a mental health unit. In
Oh,
fact, they're no different to people that are in a general hospital, right? If you go in for a cardiac arrest or you go in for a stroke or whatever, there's no reason why people should feel stigmatized because they've gone in because they've had a psychotic episode. They're in hospital, they're unwell, they're there to get better. That's it. But I think often, particularly in society where people have this view on those in mental health services, and equally people in mental health services have a view on themselves and their own self-worth, by introducing volunteers that come in through closed cycle, opening up the doors of a mental health unit and saying, look, it's not what you imagine, and vice versa. Actually, you're okay. You can be part of society and community, and we're not going to
yeah.
judge you. So I
Yeah.
think that whole piece about community, self-worth, hope, destigmatization, it's just fundamental. It's a really key part to community closed cycle.
Wow. I'm going to take that on board and process that and I hope that the right people listen to this interview and hear your thoughts on that as well. Thank you so much, Matt, for your time and your wisdom. And yeah, let's look forward to a future of giving people what they need and more and hope. Roots of
Yeah.
hope. There we go. Thank you so much.
Thanks, Charlotte. Keep doing what you're doing.